The accomplished skier, a multiple-time Olympic medalist, recently shared a harrowing account of a severe injury sustained during a high-stakes competition at the Winter Olympics. In a detailed update shared on social media, she revealed the extent of the trauma to her left leg, which nearly resulted in amputation due to a serious medical complication following a crash. The incident occurred earlier in the month, and after an extended hospital stay of 2 weeks, she finally returned home. Describing it as the most extreme, painful and challenging injury of her career, magnified exponentially, she provided a comprehensive rundown of the events. The primary damage was a complex fracture to her tibia, where the bone shattered into multiple pieces, requiring intricate surgical intervention. Compounding the fracture was the onset of compartment syndrome, a condition where excessive blood accumulation in a confined space exerts immense pressure, effectively crushing surrounding tissues including muscles, nerves, and tendons. This buildup restricts essential blood flow, oxygen, and nutrients, leading to intense pain and potential long-term damage if not addressed promptly. She emphasized the excruciating nature of the syndrome, underscoring how it amplified her suffering. In her recounting, she expressed profound gratitude toward her longtime surgeon, crediting him with preserving her limb. Emotionally, she noted that he performed a critical procedure known as a fasciotomy, which involved making incisions along both sides of her leg to relieve the pressure, allowing the tissues to expand and recover. This intervention, she stated, was pivotal in preventing amputation, and she became visibly moved while acknowledging his life-saving efforts. The crash itself happened during her comeback attempt at the Olympics, specifically in the women's downhill event. Just seconds into her run, she clipped a gate, veering off course and resulting in the tibia fracture. Additionally, the impact broke her right ankle, necessitating that she use a wheelchair for mobility over the next couple of months as part of her recovery process. Prior to this Olympic mishap, she had suffered another injury, a torn ACL, during a preparatory race in Europe. Reflecting on the sequence of events, she philosophically viewed it as fateful, because the earlier injury ensured her doctor's presence at the Olympics. Without that coincidence, she believes the outcome could have been far worse, as he was on hand to perform the emergency surgery. This perspective highlights her belief that events unfold for a reason, turning potential setbacks into silver linings. The reconstructive surgery on her tibia lasted 6 hours and was described as highly successful, though her hospital stay extended beyond initial expectations due to complications. She experienced significant blood loss from multiple procedures, leading to low hemoglobin levels that caused weakness and uncontrolled pain. A blood transfusion was required to stabilize her condition, after which she began to improve and was eventually discharged. Looking ahead, she plans to dive into rehabilitation immediately, taking a step-by-step approach as she always has. While uncertain about the full extent of her recovery, she remains determined to push forward. The pain has been overwhelming, and the injury marked an undesired end to her Olympic participation, but she harbors no regrets about competing. Despite being sidelined, she found inspiration in watching her teammates excel at the Games, representing their country with dominance. Their achievements have been uplifting, filling her with pride and motivation during her difficult time. Concluding her update on an optimistic note, she reassured supporters that she will be all right, though the road to recovery is lengthy and arduous. Her fighting spirit persists, and she appreciates the outpouring of love and encouragement, which has been both amazing and overwhelming. Preferring to end her competitive chapter on her terms, she values the attempt over inaction, embodying a philosophy of perseverance and courage. Expanding on this narrative, the athlete's career has been defined by triumphs and tribulations, with numerous medals from Olympic and World Championship events. Her return to the slopes after retirement showcased remarkable resilience, driven by passion for the sport. The downhill event, known for its speed and risk, demands precision, making even minor errors catastrophic. Compartment syndrome, a medical emergency, requires swift intervention to avoid irreversible damage. The fasciotomy procedure, while invasive, is standard for relieving pressure, involving careful incisions to prevent further complications like infection or scarring. Her doctor's role exemplifies the importance of trusted medical teams in elite sports. Long-term relationships allow for personalized care, crucial in high-pressure situations. The ACL tear prior added complexity, but as she noted, it serendipitously positioned help nearby. This mindset of finding purpose in adversity has likely fueled her past comebacks from injuries like knee surgeries and crashes. Rehabilitation will involve physical therapy, strength training, and possibly adaptive equipment during the wheelchair phase. Mental fortitude plays a key role, as athletes often face psychological hurdles alongside physical ones.